Hi, my name is Mia Collins. I'm one of the providers here at Urgent Care 24/7, and I just wanted to talk to you today about the difference between the common cold and influenza. So the common cold and influenza share a lot of common symptoms. It's kind of hard to discern without certain proper screening tests, such as the in-house screening test that we provide here, which tests for influenza A and B. But both can cause headache, a lot of discomfort, maybe a sore throat, sneezing, runny nose. Common symptoms associated with the flu are to have a fever that lasts around 3 to 4 days, body aches, chills, a headache, sometimes a sore throat, and some of these symptoms can overlap with the cold, but it's a much more severe form of having what cold-like symptoms feel like. And you're just really gonna wanna focus on noticing if your body has the chills, has the myalgias or the body pains, and kind of a fever that lasts a few days. The influenza virus can cause some serious secondary complications. Sinusitis may be one of them. That's more milder form, but still a complication, all the way ranging to pneumonia, which is a very serious illness that can cause hospitalization, as well as inflammation of the heart or the brain. Some serious complications can ensue from the influenza virus, and some of these warning signs to look for in an adult are not being able to tolerate food or water, decreased urine output, an increase in the rapid rate that you're breathing, difficulty in breathing, feeling short of breath, feeling dizzy, having abdominal pain, having a fever that just won't respond to any of the medications that you've been prescribed or any oral medications for fever. Some serious complications and warning signs to look for in children who have the influenza virus are going to be shortness of breath or a rapid rate of breathing, or if their ribs are tugging down, if there's blue around the mouth, if there has been a markedly decrease in their urine output. If, say, a child is in diapers, they aren't producing any urine in their diaper for at least 6 to 8 hours. If there's confusion, severe weakness, or inability to walk, you're going to want to take this child immediately to your nearest clinic or an ER. So the prevalence and the time of year for flu usually occurs around fall and winter. There are 4 different strains of influenza: influenza A, B, C, and D. Usually when you're going to the doctor, you're getting screened for influenza A or B. Influenza C causes more of a mild, maybe a flu-like illness or more of like a common cold in humans, and D does not affect humans whatsoever. Influenza A is more of a rapidly changing influenza strain, and it's included in every year's influenza vaccination, as is the influenza B strain. They're both included. Influenza B just kind of morphs more slowly over time. The common cold usually has the highest prevalence in August and September, so a little like right before maybe influenza would strike, but there's 200 different kinds of viruses that can cause the common cold, and influenza and the common cold can hit year-round, but these are the higher points of time which people become affected, and it's pretty easy to pass around. So the common cold and influenza viruses are usually spread through droplet contamination. That means through sneezing, any kind of contact with saliva, or contact after you've touched your mouth, your nose, your eyes, any kind of mucous membrane or anything that's exuding some discharge. Maybe you touch a doorknob and then someone else comes behind you and touches that same surface. And then you touch your face unknowingly, you can easily spread that or come in contact with that virus. Even as far as a sneeze goes, even if you're covering your mouth, these droplets can travel up to 6 feet away from the person. So it's really, really important that you cover your mouth when you're sneezing or coughing, and that you do very diligent practice of hand washing. Also, it is really important to know that you are contagious a day before you even are aware that you're feeling these symptoms, and you're most contagious 3 to 4 days after you first kind of contracted that illness. So the best way to prevent acquiring the flu is to be diligent about hand washing and to get the flu vaccine every single year. The flu vaccine prevents thousands and thousands of hospitalizations every year and thousands of deaths. The CDC reported that between 2017 and 2018, almost 1 million people were hospitalized due to the flu because it wreaks such havoc on your system. So one way to ensure that you're avoiding this is by getting the vaccine every single year and being consistent about it. When you receive the flu vaccine, your body creates antibodies to that virus that was injected into your system, and it takes about 2 weeks for these antibodies to fully take effect. All healthy individuals are encouraged to get this beginning at 6 months of age up until 65. When you get this, not only are you protecting yourself and your family, but you're protecting your community. While there is no main treatment option for flu, the usual treatment option is just supportive care to increase fluids, to decrease your fever, to get plenty of rest. It is really important that at the first sign of feeling any kind of influenza-like symptoms that you immediately contact your doctor, because there is an option within that first 48 hours of feeling your symptoms that you can receive an antiviral medication called Tamiflu, for example. And if given within the first 48 hours of you feeling these flu-like symptoms, it can markedly decrease the severity of your symptoms or kind of protect you from maybe further complications ensuing in the future. And an antiviral is really a medication that's just going to help slow the reproduction of the virus in your system.